Flares and outflares as being a post-inflammatory problem. You can occasionally see some issues with inflare, outflare if we have just a rotational anomaly. I've seen a fair amount in one runner of mine, a marathoner, that occasionally will get a little bias of an inflare, outflare issue when she has SI joint problems. So it's definitely possible that we have that more universally, and they either become corrected with the techniques we're using for correcting the rotation, and this patient just happens to have enough compensations from decades and decades of distance running that it just becomes more of an issue for her. But I do tend to see, if I have had patients that have had SI joint inflammatory problems, once that inflammation resolves, I've seen more consistency with inflare, outflare restrictions after that. Okay, so like I was saying, I think Gail and I would probably argue about these things, but my take on the combination of movements is we would get posterior rotation with inflare, and then anterior rotation with outflare. Okay, and again, I think of the pubic symphysis here as that's connected here in the front. If I rotate forward on one side, that pubic symphysis is not translating over to accommodate for an inflare. Right? So as it rotates that direction, I expect it to open up going this way because the pubic bone is in the way. That's the way I view the mechanics of it. And I think the, whatever it is, 12 years that I've been looking at these things in the clinic and seeing this very consistently, and I would say universally, I think that's the way these things are coupled. Now, will it necessarily matter as long as you can do the assessment and determine which direction, inflare or outflare, that's actually limited? Probably not. As long as you can do the determination, do the test, and figure out which one you need to work on. So from this position, I would be able to look at outflare for the left side or inflare from the right side. Okay, if I want to test the other two motions, the opposing motions on both sides, I'd have to switch myself on this, bring myself to the other side of the table. Okay, so for this, I would fix the right side of her pelvis. I would come off just medial to the ASIS, and I'm just following the vector of my finger, my index finger here, as I produce an outflare moment. And again, I'm biasing this a little bit into posterior rotation. Okay? Now, if I was going to switch that, I'm going to come here onto the right ASIS. I'm going to fixate the left side, and I'm going to compress into an inflare, basically coming up toward her belly button. And you can probably see that looks like that's moving pretty decently, right?
You're just feeling for movement, not necessarily reproduction of pain.
No, I'm past the point of reproduction of pain.